Muscles, fascia, and tendons. Often the problem is at the enthesis. The enthesis, again, is where the tendon, where any structure attaches to the bone. In this case, it's a tendon that's attaching to the bone or the fascia. Only half the enthesis is soft tissue. The other part's obviously the bone itself. The bony side of the enthesis will be covered in the bone video. It's important to understand that most of these muscle problems happen at the enthesis, and if it's a chronic condition, 40% of these involve the bony side. We'll talk about that in the bone video. Any good muscle stretching book is your Bible. Any muscle technique that you use now, any muscle lengthening technique is good. You just change a couple of things. Introduce long axis traction. That's making the origin and insertion further apart. And changing the technique according to the patient's response are the two keys to success. We'll be talking biceps femoris, semitendinosus, semimembranosus with this, and pain in the hamstring. Pain in the hamstring, maybe mid-belly of the hamstring, I'm not too sure where, so I want to kind of figure things out. So being the hamstring, I'm saying, okay, well, is it going to be the hamstrings? We know there's semimembranosus, semitendinosus, and biceps femoris. So I want to stretch, I want to see if I can reproduce the symptoms. So you say no. Does that reproduce the symptoms? No. Okay, let's try over semimembranosus, semitendinosus. Does that reproduce the symptoms? No. Okay. So let's try biceps femoris. If that reproduces your pain, okay, so even though the hamstring is a common origin, the insertion's different, and by stretching the biceps femoris, we seem to get that. Now, is it the long head or the short head of biceps femoris? Well, let's look for tenderness. Sore there? Probably the short head of the biceps femoris. So what I'm going to do is I'm going to stretch that muscle, and I'm going to do a trigger point at the same time. See, the traction increases the pressure. The ischemic compression, or the trigger point, increases the pressure as well. Why not do both at the same time? That your pain right there? It is, eh? Okay, can I go a little more? Then I can do post-isometric relaxation in the sense I want you to bend your knee now a little bit. Bend it and relax. Bend it and relax. So I'm doing the trigger point and the traction, and then let it go. Can I do that again? Okay. Bend your knee and let. Now, if I put a belt on there, I do long axis traction as well. I can lift up to increase the traction even more so because the origin and the insertion are going further apart. I just want to show you any muscle stretching book on the Wikipedia, different muscle stretches. You can use any of these procedures at all. You change it up a little bit in the sense you do long axis traction. That means you're pulling. For example, long axis traction means you're pulling the whole leg that way. And you also change it, the direction a little bit according to the patient's response.